Imagine starting your day with legs that feel strong, steady, and full of energy. No more muscle weakness, no more cramping, and no more worrying about balance or unexpected falls. If staying active, independent, and confident is your goal, nutrition plays a powerful role. Today, we're revealing 7 essential vitamins and minerals that can help keep your legs strong and resilient. These nutrients support everything from muscle function and bone strength to better circulation. Whether you enjoy long walks, dancing, or just want to feel steady and independent, this video is for you. Before we dive in, I'd love to know, where are you watching from? Drop a comment below and feel free to share any questions. And don't forget to hit that subscribe button and turn on notifications so you never miss a tip to support your health. Let's start with one of the most critical nutrients, vitamin D. Why vitamin D matters for strong legs. As we get older, our bodies naturally change. Muscle mass begins to decrease, bones become less dense, and movements that were once second nature can start to feel more difficult. One often overlooked reason? Vitamin D deficiency. It's not just about bone health. Vitamin D is key to keeping your legs strong, balanced, and able to support you confidently. Unfortunately, as we age, our skin becomes less efficient at producing vitamin D from sunlight. Add to that the fact that many older adults spend less time outdoors, and the result is a widespread deficiency that slowly weakens the muscles, especially in the legs. Research consistently shows that low vitamin D levels are linked to muscle weakness and a higher risk of falls. One major study, published in the Journal of Clinical Endocrinology and Metabolism, found that seniors with healthy vitamin D levels had stronger muscle fibers, better balance, and improved coordination, dramatically lowering their risk of falls and fractures. The effects of vitamin D deficiency. A deficiency in vitamin D accelerates muscle loss, making even basic tasks like climbing stairs or standing up from a chair more challenging. But vitamin D isn't just crucial for calcium absorption or bone health, though those are important. This powerhouse vitamin directly impacts muscle function by promoting protein synthesis and improving communication between your nerves and muscles. Think of it like a fuel source for your leg muscles. Without enough of it, they struggle to perform at their best. Studies show that vitamin D plays a vital role in maintaining fast-twitch muscle fibers. These fibers are essential for quick reactions and balance, helping to prevent falls by allowing the legs to respond quickly when balance is compromised. Without enough vitamin D, these fibers deteriorate, leading to slower reactions, weaker muscle contractions, and a higher risk of injury. Vitamin D also helps reduce inflammation in muscle tissues, which can ease chronic pain and discomfort that many seniors experience in their legs. If you suffer from frequent cramps, stiffness, or unexplained leg pain, optimizing your vitamin D levels might be the solution you've been looking for. The consequences of ignoring vitamin D deficiency. Ignoring a vitamin D deficiency doesn't just result in weaker legs, it opens the door to serious health risks. The most alarming of these is osteoporosis and fractures. Without adequate vitamin D, your body can't absorb calcium properly, leading to brittle bones that are highly susceptible to breaks. Even a minor stumble could lead to a major fracture, severely affecting mobility and independence. But the impact doesn't stop there. Vitamin D deficiency has also been linked to a greater risk of heart disease, cognitive decline, and a weakened immune system. Seniors who neglect their vitamin D intake don't just risk weak legs, they also face a higher chance of chronic illnesses that can diminish their overall quality of life. Maximizing vitamin D absorption. For optimal vitamin D absorption, spending 15 to 30 minutes in direct sunlight can make a significant difference. Late afternoon exposure is particularly effective, and exposing your arms and legs helps maximize absorption. However, be mindful of sunscreen, as it can block vitamin D synthesis. Vitamin D-rich foods. While food alone may not meet your daily vitamin D needs, incorporating fatty fish like salmon, mackerel, and sardines, along with fortified dairy products, egg yolks, and mushrooms, can help boost your intake. Vitamin D supplements. For many seniors, especially those who spend limited time outdoors, a vitamin D supplement is essential. Most experts recommend 800 to 1,000 IU per day for optimal bone and muscle health, though higher doses may be necessary for those with severe deficiencies under medical supervision. If you're unsure about your vitamin D levels, a simple blood test can provide clarity. Many doctors now routinely check for vitamin D deficiency in older adults, recognizing its critical role in preventing falls and fractures. Calcium for strong bones and muscles. Unlike younger individuals whose bones are still actively remodeling, seniors experience a gradual loss of bone mass, making them more susceptible to fractures. This is especially dangerous for the legs, as hip fractures, femur breaks, and stress fractures in the lower limbs are among the most serious injuries older adults face. A minor fall that might have been harmless in youth can lead to months of recovery or even permanent mobility loss when bones lack the necessary calcium reserves. But calcium's role isn't just limited to bone strength. It also plays a crucial role in muscle contraction. Every movement, from taking a step to rising from a chair, relies on the interaction between calcium ions and muscle fibers. Calcium acts as a trigger for muscle contraction, ensuring smooth and controlled movement. Without adequate calcium, muscles may cramp, feel weak, or fail to generate the force needed to maintain stability. This is why individuals with calcium deficiency often experience frequent leg cramps, sluggish movement, and reduced muscle endurance. Getting enough calcium. While dairy products like milk, yogurt, and cheese remain some of the richest sources of calcium, they aren't the only options. Leafy greens such as kale and bok choy, almonds, tofu, sardines, and fortified plant-based milks are also excellent sources of calcium. The key is variety. Incorporating multiple sources of calcium into your diet ensures better absorption and supports bone health. However, for individuals with dietary restrictions or absorption issues, calcium supplements can be a valuable addition, particularly when combined with vitamin D, which enhances calcium absorption. That said, more isn't always better. Excess calcium, especially from supplements, can lead to calcium deposits in arteries, kidney stones, and digestive issues. Striking the right balance is crucial, and the recommended daily intake varies based on individual needs. Calcium recommendations and benefits. For seniors, the recommended calcium intake is typically 1,000 to 1,200 milligrams daily, preferably sourced from a combination of natural foods and supplements when necessary. However, just getting the right amount of calcium isn't enough. Weight-bearing exercises like walking, resistance training, and light jogging play a crucial role in calcium's effectiveness. These movements stimulate bone remodeling and help direct calcium to the bones and muscles where it's most needed. Without regular movement, even optimal calcium intake can't fully strengthen the skeletal system. Neglecting calcium doesn't just affect bones, it impacts mobility, the ability to engage in activities you love, and overall independence. A life filled with mobility, stability, and confidence begins with strong bones and well-functioning muscles, both of which rely on adequate calcium. Vitamin B12 for neuromuscular health. When it comes to leg strength, most people focus on calcium and protein, but vitamin B12 is equally vital. Vitamin B12 is responsible for keeping nerves healthy, ensuring that electrical impulses traveling through the spinal cord to the legs are strong and precise. Without adequate B12, muscles won't receive the right signals, leading to weakness, instability, and a gradual loss of control over movement. One of the most common symptoms of B12 deficiency is heavy, tired legs, often accompanied by numbness or tingling. The problem is that vitamin B12 deficiency is surprisingly common in older adults. Unlike other vitamins that can be stored in fat or absorbed through a wide range of foods, B12 absorption relies heavily on digestive health. The body needs adequate stomach acid and a special protein called intrinsic factor to extract B12 from food. As we age, stomach acid production decreases, and conditions like gastritis, acid reflux, and the long-term use of antacids can further impair B12 absorption. Many seniors unknowingly consume diets low in B12-rich foods, leading to a gradual depletion of this crucial nutrient. The consequences of B12 deficiency go far beyond fatigue. Uncorrected depletion can cause irreversible nerve damage, affecting balance, coordination, and reflexes. Many seniors who experience frequent falls or difficulty walking are actually suffering from the neurological effects of B12 deficiency, which is often dismissed as just a normal part of aging, when, in fact, it is entirely preventable. Restoring B12 for better mobility. Restoring vitamin B12 levels can profoundly impact mobility and energy. Studies show that seniors who correct their B12 deficiency experience noticeable improvements in strength, endurance, and leg function. Vitamin B12 is found primarily in animal products, including lean meats, fish, eggs, dairy, and shellfish. For those on plant-based diets or who have absorption issues, B12 fortified foods such as cereals and plant-based milks or supplements are essential. The good news is that B12 is one of the safest vitamins to supplement, as excess amounts are excreted in urine. Many older adults benefit from taking higher dose B12 supplements or receiving periodic injections, especially if absorption is difficult. Regular blood tests can help ensure optimal B12 levels, preventing a decline in leg function. It's important to recognize that strong legs aren't just about physical strength. They depend on nervous system efficiency, reaction time, and coordination. Maintaining adequate B12 levels is a powerful yet often overlooked strategy to preserve mobility and quality of life. Magnesium's role in leg health. Every time you take a step, magnesium plays a behind-the-scenes role, ensuring that your muscles receive the signals needed to contract and relax smoothly. It acts as the master regulator of muscle function, helping prevent spasms, reduce fatigue, and support endurance. A common but often overlooked symptom of magnesium deficiency is restless leg syndrome and frequent nighttime leg cramps. These painful muscle contractions disrupt sleep, making it harder for seniors to recover from daily activities. Magnesium doesn't just help with muscle function, it is also crucial for bone density and joint health. While calcium gets much of the attention when it comes to bone health, it can't do its job effectively without magnesium. This mineral helps regulate calcium transport, ensuring that calcium is incorporated into bones rather than being deposited in soft tissues, where it could cause stiffness and joint pain. Studies show that higher magnesium intake is linked to greater bone strength and a reduced risk of fractures in aging adults. Magnesium deficiency is common due to factors like stress, medications, and poor dietary habits. Many older adults take medications that deplete magnesium, including diuretics and proton pump inhibitors, while also consuming diets low in magnesium-rich foods. This can lead to a gradual loss of stamina, slower movement, and increased fatigue. The good news is that replenishing magnesium levels can quickly improve leg health, reducing cramps, boosting energy, and restoring ease of movement. Magnesium-rich foods. The best dietary sources of magnesium include leafy greens, nuts, seeds, whole grains, and legumes. Foods like pumpkin seeds, almonds, spinach, black beans, and avocados are especially rich in magnesium and offer a natural way to maintain muscle and bone health. However, for those who struggle to get enough magnesium from their diet, supplements like magnesium citrate or magnesium glycinate, which are more easily absorbed, can be effective. Restoring magnesium levels can have a remarkable effect on leg health. Seniors who once felt sluggish and heavy may find their legs responding with renewed energy. Those who suffered from frequent muscle cramps or weakness often experience relief as magnesium levels are replenished. Magnesium's impact on movement. When magnesium levels are restored, seniors often experience relief from stiffness, improved sleep, and more fluid movement. Magnesium helps regulate neuromuscular connections, which is essential for balance and coordination. By enhancing muscle relaxation and reducing involuntary contractions, it enables smoother movement and reduces the risk of falls, a critical concern for older adults. Potassium's crucial role. Imagine waking up and feeling a painful calf cramp. This is often due to low potassium levels. Potassium is vital for muscle function as it helps balance fluids within muscle cells. When potassium is low, muscles may contract involuntarily, leading to cramps, especially in the legs. For seniors with reduced circulation or muscle mass, these cramps can become debilitating. Potassium also plays a key role in communication between nerves and muscles. Low potassium levels make this communication inefficient, leading to shakiness, weakness, and difficulty lifting the feet, significantly increasing the risk of falls. Moreover, potassium helps neutralize acids that can break down bone density over time, reducing the risk of osteoporosis and maintaining strong bones in the legs. To ensure adequate potassium, consider incorporating foods like bananas, sweet potatoes, spinach, beans, and oranges into your diet. A baked potato with its skin can even provide more potassium than a banana. For those who struggle to meet their potassium needs through food, supplements may be beneficial. The recommended daily intake is 2,600 milligrams for women and 3,400 milligrams for men, though those with health conditions affecting potassium levels should consult their healthcare provider. Vitamin K for bone and joint health. While calcium and vitamin D are well known for strong bones, vitamin K is the critical nutrient that ensures calcium is deposited where it's needed, into the bones. Without vitamin K, calcium can accumulate in arteries or soft tissues, leading to stiffness, poor circulation, and even cardiovascular disease. Vitamin K activates osteocalcin, a protein that binds calcium to the bone matrix, making bones denser and less prone to fracture. Studies have shown that individuals with higher vitamin K intake have stronger bones and a lower risk of fractures. Vitamin K also plays a role in joint health by reducing inflammation, which can help slow the progression of osteoarthritis and ease knee stiffness. This is especially important for seniors who experience discomfort in their joints. If you've noticed that your knees ache or feel stiff after sitting for a while, vitamin K might be the missing link to maintaining flexible, mobile joints. Vitamin K for muscle strength and coordination. Vitamin K plays an important role not only in bone health, but also in muscle function and coordination. As research suggests, vitamin K helps regulate calcium levels within muscle cells, ensuring proper muscle contractions, and preventing uncoordinated movements. For aging adults, this means better balance and a reduced risk of falls, as vitamin K contributes to overall muscle strength and coordination. Leafy greens like spinach, kale, and Swiss chard, as well as cruciferous vegetables like Brussels sprouts, are rich in vitamin K1. Additionally, fermented foods like natto, fermented soybeans, aged cheeses, and animal products like egg yolks and liver are sources of vitamin K2. Vitamin K2 is particularly beneficial for its ability to stay active in the body longer, directing calcium into bones rather than arteries. To increase vitamin K levels naturally, consider adding green vegetables or fermented foods to your meals. However, if you have difficulty absorbing vitamin K or take long-term antibiotics, supplementation may be needed, but always consult a healthcare provider, especially if you're on blood-thinning medications, as vitamin K can interact with these medications. Vitamin B6 and muscle function. Vitamin B6, also known as pyridoxine, plays a critical role in maintaining muscle strength and overall leg function. This vitamin is essential for nerve health, muscle repair, and ensuring that the body can effectively use protein to maintain muscle mass. Without adequate B6, muscles can weaken, making simple movements like standing or walking feel exhausting. B6 is particularly important for nerve signaling and coordination. A deficiency can lead to numbness, tingling sensations, and unsteady walking patterns, symptoms that are often mistaken for aging-related muscle loss. Additionally, vitamin B6 helps prevent inflammation-induced muscle fatigue, which means better flexibility and resilience in the legs. B6 is also crucial for red blood cell production, ensuring that muscles receive the oxygen they need to function properly. A lack of vitamin B6 can lead to lower hemoglobin levels, which means reduced oxygen supply to muscles and early fatigue. Foods rich in B6 include poultry, fish, like salmon and tuna, bananas, potatoes, chickpeas, and fortified cereals. If you have trouble absorbing B6 or have dietary restrictions, supplements may be necessary, but excessive intake should be avoided as it can cause nerve damage. If you found this video helpful, please hit the like button to support us in bringing more valuable content. Share your thoughts and questions in the comments below, and let us know what topic you'd like us to cover next. Don't forget to subscribe and turn on notifications so you never miss out on our latest health tips.